in a city that never sleeps, where every second matters, where hope and heartbreak share the same corridor. There stands a beacon, a promise rooted in compassion, a legacy driven by vision. Established in 1991 by Padma Bhushan late Shri Karamchi Bhai Jetabhai Somaiya, KJ Somaiya Hospital and Research Center was built on one belief: healthcare with humanity at its heart. A 550-bed hospital, a powerhouse for education, research and care. But today, we tell a deeper story. Haemophilia.
Labhanam Shreya Arogyam. Of all gains, the greatest one is of good health. Hello everyone, my name is Somaiya, Chairman, KJ Somaiya Medical Trust. This place we call Somaiya Ayurvihar. इसकी स्थापना हमारे दादा करमशी जेठाभाई सोमैया ने की थी और नाम सोमैया आयुर्विहार रखा था. आयुर्विहार to mean a place of life. Under Somaiya Ayurvihar, we have the KJ Somaiya Medical College and Hospital. My wife Amrita, her mausi, when she passed away, in her will, she left behind money to create a center to help patients suffering from cancer, blood disorders, and to find solutions to that. So we have created a center where bone marrow transplants take place and where clinical trials also take place for helping find new solutions and helping people suffering from blood disorders such as haemophilia.
Haemophilia is not just a bleeding disorder. It's a lifelong genetic condition, mostly affecting males, caused by deficiency of clotting factors. A bruise is not just a bruise. A fall is not just a fall. Bleeding happens silently, inside joints, muscles, vital organs, even the brain. Each untreated bleed causes irreversible damage. In India, over 130,000 severe cases are estimated. Yet only about 26,000 are registered. The real crisis? Underdiagnosis.
The establishment of Hematology Department and the BMT unit at KJSHRC has marked a defining moment. We envisioned a center that could diagnose, treat, research and innovate under one roof.
Diagnosis requires precision. Advanced labs, costly reagents, specialized equipment. Tests cost 5,000 rupees to 20,000 rupees. For many families, this means travel, lost wages, and long waits. Diagnosis becomes a burden instead of a solution.
There is an acute shortage of coagulation labs in the country. A good comprehensive laboratory should be able to diagnose not only hemophilia, but all types of bleeding disorders. Apart from the complex infrastructure what we require with ultra-cool freezer facilities, expensive equipments, maintaining a good quality control of the investigations is extremely important. It's very disheartening at times to see patients coming to the department after traveling 2 to 3 days to get a single confirmatory test.
In 2023, a new chapter began. With the generous support of Srimati Nandini Priyakant Munshaw, a state-of-the-art bone marrow transplant unit was established. Specialized isolation rooms, advanced filtration systems, a full hematology department, a clinical research unit. This was not an expansion. This was evolution.
Diagnosis is an important part of medical care. Translational research bridges the gap between novel discoveries and clinical application, aiming to improve human health by turning laboratory findings into new diagnostics and treatment.
What if diagnosis didn't need complex machines? Scientists at KJ Somaiya Hospital developed rapid tests for bleeding disorders. Simple, affordable, accessible. Results in 5 to 10 minutes. Cost 100 to 150 rupees. The research projects supported by national research bodies like ICMR and DBT enable this innovation with real-world impact. All these technologies are protected under the Indian Patent Act with support from ICMR Patent Mitra, transforming ideas into nationally recognized innovations. But behind this simplicity lies carefully engineered science. For the lateral flow immunoassay, every strip begins with a purpose. Tiny gold are linked to antigens or antibodies, forming the signal system of this test. A nitrocellulose membrane is prepared. And all components are assembled in perfect alignment, encased into a compact cassette. When a drop of blood or plasma is added, a visible test line appears for inhibitor positive sample. For inhibitor negative sample, no test line is seen. A result, once hidden in complex machinery, is now revealed by a simple strip. For the latest agglutination test, the science is just as elegant. It begins with latex beads coated with specific reagents when mixed with a drop of patient sample on a reaction card. If the factor VIII antibodies are present, tiny particles begin to clump together, showing positive agglutination. Negative test will not show any agglutination. A visible reaction readable by the naked eye. No advanced equipment, no expensive reagents, usable even in resource-limited settings. Built not just for labs, but for villages.
The work of our hematology department, which is going on nationally, internationally, and which is also in line with Indian Council of Medical Research and Ministry of Health Department funding. It will help India in Make in India project. Also, the poor families who are suffering from the hematological disorder, they will be all benefited by this research program.
Nearly 30% of hemophilia A patients develop inhibitors, making standard treatment ineffective. Traditional testing is expensive and time-consuming.
नमस्ते, मेरा नाम चेतन मोतीवरस है और मैं हीमोफिलिक पेशेंट हूँ। मुझे हीमोफिलिया ए है, यानी मेरे बॉडी में फैक्टर 8 की डिफिशिएंसी है। ब्लीडिंग का दर्द तो मुझे होता ही है, बट उससे भी बड़ा दर्द होता है अनसर्टेनिटी का। आज भी ऐसे सिंपल और एक्सेसिबल टेस्ट अवेलेबल नहीं है जो ये क्लैरिटी से बता सके कि ब्लड में हेमलिब्रा का लेवल क्या है या बॉडी में इनहिबिटर प्रेजेंट है या नहीं।
With new therapies like emicizumab, monitoring became essential, but globally challenging. So, a solution was created. Multiplex lateral flow immunoassay. Using antibodies in sandwich assay format, they developed a low-cost detection test, detecting critical drug levels. No test line represents less than 10 microgram per milliliter of emicizumab level. Presence of one test line represents 10 to 25 microgram per milliliter of emicizumab level, and presence of both the test line represents more than 25 micrograms per milliliter of emicizumab level. Precision medicine made affordable.
At KJ Somaiya Hospital, we are treating almost 300 to 400 patients with hemophilia and various other bleeding disorders. Over here, we have found out the new techniques for getting the point of care test like von Willebrand disease, then factor VIII inhibitors, factor VIII, factor IX levels. Newer methods have been investigated and invented for documenting the emicizumab level in the patient's body. As we all know that when patient is on emicizumab, this routine tests like a PT, APDT, factor levels and inhibitor assays cannot be performed as they may be giving the wrong results.
The point-of-care tests patented by the Department of Hematology for hemophilia patients will go a long way in identifying more patients in our country, and that will lead to better care and management.
Hemophilia may begin in genes, but its story does not end there. At KJ Somaiya Hospital, science goes beyond laboratories. From 20,000 rupees to 150 rupees. From hours to minutes. from uncertainty to clarity. This is not just research, this is resilience. This World Haemophilia Day, we stand for awareness, we stand for accessibility, we stand for affordable innovation. Because when diagnosis becomes equitable, when healthcare reaches every corner, no disorder is too rare, no village too remote, no child forgotten. This is more than diagnosis. This is a movement. Because when care is accessible and science is compassionate, no family stands alone and no drop of hope is ever wasted. KJ Somaiya Hospital and Research Center. Advancing science, restoring lives.